The blade spins through the air, silver and lethal. Dr. Kira Voss's hand snaps up without hesitation, catches it mid-flight, places it on the instrument tray. Her other hand never stops suturing the pulmonary artery. Her eyes never leave the surgical field. The alien instructor who threw it, Master Surgeon Velrith of the Threxian Dominion, stands frozen, his reptilian crest flaring in disbelief. In the observation gallery above, dozens of alien students watch in stunned silence. A human just did the impossible. Station Meridian's Galactic Medical Institute trains the galaxy's elite surgeons. 50 species study here, learning to save lives across 1,000 different biologies. The standards are brutal. The dropout rate is 70%. Humans are rare here, considered too emotional, too easily distracted for the precision medicine demands. Dr. Kira Voss has been fighting that perception for 3 years. She's 29, lean and focused, with scars on her hands from endless practice sessions. She doesn't talk much, doesn't socialize. Every free moment, she's in the simulation labs training. 5 years ago, during a colonial raid on Outpost Vega, Kira was performing emergency surgery on a 12-year-old girl. Shrapnel wounds, arterial bleed, survivable. Then gunfire erupted in the corridor outside. Kira froze. Just for 10 seconds. Just long enough for the girl to bleed out. The girl's name was Sophie. Kira still sees her face. The Threxians dominate galactic medicine. 8-foot reptilian predators with surgical precision, coded into their DNA. Their brains process threats and tasks separately. They can work through combat without distraction. Master Surgeon Velrith is their finest instructor and their greatest skeptic of human capability. He believes humans are too fragile for trauma medicine. Kira is about to prove him catastrophically wrong. The final certification exam. Live tissue biosynthetic patient. Catastrophic injuries simulating a station accident. 18 minutes before brain death. Kira scrubs in, her movements economical and precise. The synthetic Threxian delegate on her table has 7 major injuries. Collapsed lung. Severed hepatic artery. Intestinal perforation. The clock starts. Kira's hands move like water, smooth and unstoppable. In the gallery, Velrith watches. Minute 5 arrives. He activates the distraction protocol. Explosive sounds blast through speakers. Lights strobe. The floor vibrates. Standard Threxian training. Can the surgeon work through chaos? Kira doesn't flinch. Her hands continue their precise dance. Clamp, cut, suture. She's repaired the artery and moved to the lung. Velrith's crest ripples. Impressive, but not enough. Minute 9. He picks up a surgical blade. Throws it across the room toward her. Not to harm, to test. Every human student before has stopped, turned, failed the exam. Humans can't help but react to peripheral threats. The blade spins through the air. Kira's left hand catches it. Never looks up. Her right hand finishes the suture on the pulmonary artery. Perfect tension. Perfect placement. She sets the blade on the tray with casual precision and reaches for the next instrument. The gallery erupts in whispers. Velrith's inner eyelids blink rapidly. Threxian shock. This violates everything they know about human neurology. Humans process threats through the same pathways as tasks. They can't separate them. They should freeze or flinch. Kira just didn't. Velrith escalates. More blades. Thrown faster. Smoke floods the simulation bay. Strobe lights intensify. Combat audio screaming, explosions, weapons fire. The cacophony that breaks concentration. Kira catches every blade. Dodges too. Never stops working. She's repairing the intestinal perforation now, her movements fluid and confident. In her mind, she's back at Outpost Vega. She sees Sophie's face, feels the paralysis, the helplessness. Not again. Never again. Minute 15. The patient's vitals spike dangerously and autonomic crisis. Standard protocol says stabilize first, but that takes time they don't have. Kira makes an intuitive choice. She abandons Threxian technique and uses a human approach, riskier, faster, bypassing the stabilization to address the root cause directly. Her hands blur. The gallery thinks she's panicking. Velrith leans forward, certain she's failing. She's not failing. She's adapting. The human flexibility her instructors criticize becomes her advantage. She improvises a vascular bypass using techniques from Earth combat medicine, solutions the Threxians never developed because they never needed them. Minute 17. Final test. Velrith throws a blade directly at her face. Kill shot trajectory. Impossible catch. Kira's hand moves. Catches it between two fingers. Spins it. Uses it to cut a final suture. Places it down. Steps back. Surgery complete, she announces. Patient stable. The monitoring system confirms it. 17 minutes, 42 seconds. Perfect outcome. Kira looks at Velrith for the first time since the exam began. Her eyes hold something beyond determination. Certainty. Velrith approaches the surgical field slowly. Examines her work. Every repair is flawless. But he also sees the human technique, the improvised bypass his people would never have conceived. He looks at the scattered blades. Explain, he says. Kira's voice is quiet, steady. 5 years ago, I froze during surgery. A 12-year-old girl died. I decided I'd never freeze again. I trained every day through every distraction I could create. Not because I'm special, because I can't let another patient die because I stopped. Velrith's crest lowers profound respect. Human neurology shouldn't allow this. You process threats and tasks together. You should have stopped. Maybe that's why it works, Kira says. I don't separate the threat from the task. I just decide the task matters more. Velrith places a clawed hand on her shoulder. You are certified. Unrestricted trauma surgery. I was wrong about humans. The footage spreads across the institute. Researchers study Kira's exam, searching for the secret. They find only will. Only a woman who refused to freeze. The institute updates its human protocols. Other species request human trauma surgeons, not because humans lack fear, but because they've mastered working through it. Kira becomes an instructor. Keeps the blades in her office. When students ask, she tells them about Sophie. About the choice to never stop. The Threxians archive her exam. Human adaptive response under impossible conditions. Years later, Kira works a real trauma bay during a station attack. Explosions echo outside. She operates calmly, debris falling around her. Doesn't flinch. Humanity's strength isn't fearlessness, it's deciding fear doesn't matter.